Hello, and welcome to Prisma Health's Business Health Solutions weekly COVID and Wellness update. I'm Dr. Rachel Brown. I'm the Medical Director of Prevention and Wellness with Business Health, and we have a lot to talk about today, so I'm going to get right to it. I do want to remind everyone that information is changing so quickly that even from the time of this recording to when it is posted, a couple of days later, things may have changed. So if you're concerned or you're hearing conflicting information, please reach out to us so that we can reconcile that for you. And I'm going to show you how to do that in just a second. But before we do, let's talk about the disease status in South Carolina. As you know, the numbers are not great. Right now, we have over 371,000 cases of COVID in South Carolina. We've reached that mark. Our current percent positive over an average over the last 2 weeks is 29.8%. Yesterday, it was 28.9%. It does appear that it may have begun to plateau somewhat. Let's talk about some of the counties across the Midlands and the upstate. In Greenville County, they're now seeing 1,756 cases per 100,000 folks there, and they have a percent positive of 38.2%, which is extremely high. In Oconee, 1,314 cases per 100,000 people with a percent positive of 30.4%. It's a little bit better in the Midlands, but still high. Richland is at 874 cases per 100,000 with a percent positive of 22.4, and Sumter is a touch higher than that at 917 cases per 100,000 folks with a percent positive of 23.4. So these are numbers that are too high. We need to see that percent positive under 5%. So again, hopefully if we are seeing a bit of plateau, hopefully we're getting on the other side of this surge of cases due to the holiday gatherings and travel and weariness of the precautions that we've been following going on almost 11 months now. We'll talk about that in a little bit. But let's talk about the good news. We've got 2 vaccines in South Carolina now. We've got the Pfizer vaccine and the Moderna vaccine. Right now, as of yesterday, South Carolina has received 313,100 doses of the vaccine and has given 137,712 of those doses. And this is information you can find on the DHEC page if you're interested in following that. So all of the questions we're getting now are, well, who can be vaccinated? When can I be vaccinated? Where can I go to be vaccinated? How do I figure out how to maneuver these phases? So let's talk through them so that you feel comfortable about this. Right now in South Carolina, we're still in phase 1A. However, we have added a couple of groups to those phases. On January 8th, we were given the directive to begin vaccinating folks who were over the age of 65 who were in the hospital and not COVID positive. So in the hospital for another reason, but they're there, they're over 65, they can go ahead and get their vaccine. The second announcement was made on the 11th. This was from Governor McMaster, who said it's time to start vaccinating our community members who are over the age of 70. So if you are in 1A, which of course before this included healthcare workers, frontline workers, long-term care facilities, and a whole list of other folks, please reach out to us so that we can help you to understand what your next steps are. But let me pause and share my screen so you can see the best resource to go to in order to get information right off the bat. So Prisma Health has developed a vaccine webpage that's going to give you the most up-to-date information. It changes as the DHEC policies, procedures, and rules change. So you can see here, phase 1A and individuals over 70 are now eligible to get that COVID vaccine. And by simply pressing on the vaccine request button, you can submit your information and Prisma Health will reach back out to you and let you know when and how you can get your vaccination. Now, I do want to also point out that you can reach out to us, and if you are currently eligible, we can help to facilitate filling out the VAMS spreadsheet and then submitting that to our folks who will enter that into the VAMS system that will register your employees who are eligible to get the vaccine and send them an invitation for scheduling. An additional way that you can encourage folks to get their vaccination or to find out if they're eligible for vaccinations is through the South Carolina DHEC VAX Locator. So that's VAX Locator. And that will show folks across the state which entities outside of, and including Prisma Health, excuse me, are ready to administer that vaccine and continue administering that vaccine to our 1A folks and our people over the age of 70. So let me show you where you can find that. Here are vaccine appointments, and you will see the vaccine locator. When you click on vaccine locator, it will bring a map to you, and each of the green dots indicates a place that may be giving vaccines to folks who are in phase 1A. We'll give that a second to come up. So you can see here with each one, it's going to give a little bit more information. So you may find that they're almost ready, or maybe they've had to put a hold, or they're waiting on their supply. So be sure to get the information you need before you call to schedule your appointment. The other thing I'd like to point you to is the VAX Facts page for South Carolina DHEC. This is also extremely helpful in keeping as up to date as possible and teasing out who's in what phase and when are these things happening. So right now, if you're confused about whether you're in phase 1, hopefully you're not confused about whether you're 70 or older or not, you can take a look here. You can see healthcare workers, long-term care facilities, as well as this list. Okay, and this is the list that's important because sometimes we forget about these folks that are in 1A, and we can help facilitate getting you registered. Okay, so now let's talk about what's coming next, 1B. So if you scroll down a little bit on this VAX Facts page, or the COVID-19 vaccine page at South Carolina DHEC, you can begin to get a peek at what phase 1B is going to look like. And all along, we've been saying 1B is going to include essential workers. And remember that essential workers are defined very specifically by DHEC and ACIP. So we will be looking very closely for their recommendations, and they will dictate who is next and who is eligible for 1B. But you can see here firefighters, policemen, food and agricultural workers, the post office workers, if you're in manufacturing or grocery stores, public transit, and teachers and daycares will be getting the vaccine next. I have also heard that this includes behavioral and mental health counselors as well. And then, of course, you can see they're already beginning to think about who's in 1C. Again, there's an age and a risk component here, a health risk component here, as well as additional categories of essential workers. So for those of you who are tuning in and from organizations, remember, just because your organization may have been considered essential in other categorizations of COVID recommendations and policies, be careful and watch carefully to see which phase you fall into based on ACIP's criteria for essential workers in 1B and 1C. I'm going to stop sharing my screen for just a second. Actually, before I do, let me show you our website. I've pointed this out numerous times, but for those of you who are tuning in for the first time, I'd like you to see that Business Health has a page here too. And we've got lots of resources for you in managing COVID and in finding out what's going on with the vaccine. Certainly links to these webinars are there, but most importantly, there's ways to contact us. So if you have a quick question, you want us to shoot you an email, happy to do that. If you'd like to schedule a consultation, we're happy to do that as well. And then, of course, you may scroll down and find the answer you're looking for here in our frequently asked questions. Okay. The last thing I want to tell you before I leave the resources here is there is one other way your organization can begin to get your employees vaccinated when it's appropriate, and that is through the closed pod system or points of dispensing. I strongly encourage organizations to consider becoming a closed pod. It will help to facilitate access for your employees, and this is a collaborative endeavor between organizations Prisma Health and DHEC, so that you can get your workforce vaccinated when they're eligible and when it's appropriate. So if you're interested, the first step in finding out more is emailing DHEC at mcm@dhec.sc.gov, and that's M as in monkey. So mcm@dhec.sc.gov. That will give you, they'll be able to answer your questions and get you started on the process if you're interested in becoming one of these closed pods. So I'm going to stop sharing my screen and come back and talk to you about some of the up and coming developments. Now, who knows when some of these are coming? I don't want to make any promises, but there is lots of talk around mass vaccination sites. They're just around the corner. In the Midlands, you'll be seeing that happen at Gamecock Park or over by Williams-Brice Stadium. Very exciting drive-through setup for vaccination for folks who are eligible. In the upstate, the venue is going to be the old Kmart down from Greenville Memorial Hospital, and that will be an inside site. And we're very excited. Prisma Health is working extremely hard to stand up these max vaccination sites. In addition to standing up many more smaller sites, every day, we're adding more and more places where folks will be able to go and get vaccinations. The other thing that's happening is DHEC is doing the same thing. They're setting up more and more sites too. I'm certain some of those will be mass vaccinations as well. Here's another exciting thing on the horizon. Word on the street is that DHEC is going to be releasing an open enrollment platform, so an app or a questionnaire, a way for folks to submit information, find out their eligibility, find out what category they're in, and get more of a information around when they can be vaccinated and where. Again, not sure when this is coming, hopefully sooner than later, but be on the lookout for that as another mechanism of enrolling yourself and getting ready to be vaccinated. Possibly on January 18th, we may be seeing CVS and other retail pharmacies beginning to open their doors to giving vaccines. They had previously been involved, Walgreens, with vaccinating at our long-term care facilities, and they are hoping to become vaccine sites for more community members. So keep your eyes out for that. Now, of course, as we move through this paradigm and we learn more and more about the best way to bring vaccines out to our community and our businesses, Business Health is talking with the task force at Prisma to find out how we can serve you best through on-site vaccine clinics, mobile units, that sort of thing. It may be more likely to occur sort of March timeframe when we have better access to the Moderna vaccine because of the supply chain issues that you all know about with deep freezing and other issues that make it more difficult to transport the Pfizer vaccine. So keep your ears and eyes out for that as well. We want to work with you. Couple of more things I want to share with you just so you have all the best and most current information. You'll also be hearing calls and decisions that are around expanding the eligibility of folks to work at vaccine sites. And this is really exciting so that we can take people who we have more folks on the ground to give more vaccines. So this is really great news. Now, I also want to tell you, we got some other vaccines in phase 3 trials, right? So it doesn't just stop with Pfizer and Moderna. So let me give you a very quick update in that regard. We've talked before about AstraZeneca. That is also a 2-dose vaccine given 4 weeks apart. It can be refrigerated, so that's going to make transport more easy. We've also talked about Novavax before, which is very similar. 2 doses, 3 weeks apart, also can be refrigerated. There's a new phase 3. Well, there's many more phase 3 vaccines out there scattered across our planet. But there's a new one that Bayer just collaborated with and made that announcement on January 8th, and it's called CureVac. They're from Germany, and they also have a 2-dose vaccine that can be refrigerated. But one of the neat things coming down the pike is Johnson & Johnson is still working hard on their phase 3 trials, and their vaccine is 1 dose. It does have to be delivered and stored frozen, but can be refrigerated for up to 3 months. So it doesn't have to be immediately thawed and administered, and it's just 1 dose. So I'll keep you up to date on the developments with the vaccines that are coming. Finally, let me just make one more plea that we're all weary of COVID. We're all tired of wearing masks. We're all tired of not being able to do the things that we want to do, see family, go to events. Some of us are even more concerned because of health issues. We're tired of the perpetual angst around COVID. And we're waiting for this vaccine to give us the herd immunity to help us to get back to what maybe we're more used to and what brings us joy in our lives. But that's just one piece of the puzzle. We still need to continue to take the known effective precautions very seriously. So as leaders in your organization, I implore you and encourage you to take a breath, maybe go back to all of the policies and procedures that you worked so hard to put into place in spring and summer, revisit them and make sure that they're still as strongly followed as you wanted them to be back then. And whether that's entryway screening with temperatures and symptom screens, barriers, social distancing, mask wearing, staggered shifts, folks working from home, flexible PTO policies, whatever it is that you've got in place, go back and make sure it's still working and that everyone is still doing the absolute best they can to curb the spread of this disease, because we need that as much right now as we need the vaccine. As always, Business Health is here for you. We want to care for you so you can care for your employees. Please reach out to us with any questions, and we'll see you next week.